To really understand why Regenexx is very different, let's take a look at one of our procedures. What you're about to see, your orthopedic surgeon can't do, the guy down the street that does a little bit of ultrasound can't do. So let's take a look at this advanced, precise, guided work. Let's look at what interventional orthopedics looks like for a knee ACL tear.
The ACL has two bundles, so it's a braided fiber. Surgical repair to date, for the most part, is a single fiber. So in the very basic concept, the biomechanics are inherently changed when surgical repair is undertaken. She had a complete tear of her fibers. The fibers are no longer contiguous and they're actually poorly organized with some retractions. She underwent stem cell therapy in January of 2016. On the right, this is the MRI dated from 5/27, approximately 5 months post-procedure, where you can actually see continuity of the fibers of the anterior cruciate. We have spent countless hours perfecting this, acknowledging that you have to inject both the origin and the insertion of the anterior medial and posterior lateral fibers. It's only then that you get the best clinical outcome. Non-Regenexx clinics that opt not to use guidance cannot successfully inject both the anterior medial and posterior lateral fibers of the ACL, and therefore cannot get the clinical outcome that we get at Regenexx. In addition to injuring her ACL during her dancing, a sprain or strain of the medial collateral ligament, it's bowing and we know it's unstable on physical examination and under ultrasound. The image to the right, dated after the stem cell procedure utilizing Regenexx SD, shows a normal, tight MCL. So today, we are adding additional platelets into both of the fibers of Brooks' ACL, which was partially regenerating utilizing the Regenexx SD. What's critical and what's one of the cornerstones of Regenexx is guidance. So to that extent, we are going to be utilizing contrast to delineate the fibers both at the origin and the insertion of the anterior cruciate. That way we can ensure exact delivery of the concentrated platelets. If you look at the concentrated platelets, they differ significantly from the bedside centrifuge platelet product available at many other non-Regenexx clinics. This is, for the most part, free of red blood cells and white blood cells. We're directing our needle towards the insertion of the anterior cruciate. Now, to confirm accurate placement of the very important platelet, we're going to put in a small amount of contrast. Again, this is only available if you take the time, energy, and expertise of utilizing guidance. I'm going to put a little bit of the platelets in there. You can beautifully see the course of one of the fibers from its insertion on the tibial spine approximately back to its origin. So we're coating the entire ACL during this process. Second injection, we got this fiber here. This is a double bundle. The anterior cruciate has two fibers that weave upon each other. You got to get both for the best clinical difference. That, in part, is the Regenexx difference. There's her ACL. And what we're trying to do is follow this ACL back to its origin. Lo and behold, that's the Regenexx difference. This is just contrast to confirm the different bundles. We have origin, insertion, anterior medial, posterior lateral, and anterior medial, posterior lateral with meniscal flow. It's all been covered.